we're going to be talking about telehealth today. So I just wanted to, give a sort of brief definition for all of us. You and I use it, but some of the viewers may not know what it all encompasses. So telehealth is sort of a broad overview term that uh, really describes any sort of interaction you have with healthcare over the internet or electronically. So it's those face-to-face or video-to-video visits that we're familiar with, the live visits we make an appointment for. We see the doctor, they do an exam and make a plan over the internet. But every time you send a message through the EMR or some other way of communicating is also telehealth. That's called asynchronous telehealth. If your child has an EEG, for example, and it's recorded, and then I read it later that day and send the report into the electronic medical record. That's also telehealth. Technically, it's over the internet, and again, asynchronous type of delivery. So, just want to make sure that we're all up to speed on what we're talking about today and how this is a useful way to deliver healthcare. Can you tell me, Alyssa, how you're currently using telehealth?
Yeah, currently I'm using it mostly for follow-up appointments. We have a lot of those between um, myself and all three of my children. Um, Mostly it's appointments that I don't have to physically be in there. So follow-ups or just consultations. I have in the past used, I think it might be what you were describing as asynchronous. Is what did you say that was again?
That's like if you capture, store, then forward images like EEG or an MRI, and then a doctor remotely reads it and makes a diagnosis and provides treatment recommendations,
I actually
stored
was
forward.
having sorry issues with m- my couldn't figure out what was wrong, but I was in a lot of pain. I was having these weird reactions. I actually reached out to a doctor that was out of state through telehealth, and he was able to order labs for me in the hospital that was local to me. And he was able to diagnose me through reviewing my history, the telehealth appointment that we initially had, and my labs. So that is another way I've used it, and it's been really successful for us.
Excellent.
Yeah.
That's a great example of how you were able to get help where you couldn't get it locally.
Sorry. I lost you.
Um, so I think that there's been a lot of changes. That doctor may not have been able to do what they did prior to COVID-19, just because each doctor has a state license and you're only able to practice medicine in that state. So uh, telehealth for pediatric epilepsy or pediatric neurology has been around for a decade since we've had good internet, but it hasn't been used a lot because doctors didn't have a ton of licenses and the hospitals weren't really set up for this. But COVID-19 kind of changed everything because, as you know, and everybody knows, the hospitals had to close and we couldn't safely see doctors face to face, and but we still needed to get updates about our seizures and get our prescriptions. So this direct to consumer model it's called, so straight into your living room, what really kind of took off, and it was used for everything, but epilepsy, autism, and other child neurology conditions that don't require tactile exam, feeling the muscle tone, for example, can't be done over the internet, is really appropriate and useful. And the state licensure requirements were temporarily lifted during COVID-19, and that's why your doctor was able to uh, see patients in other states, and the hospitals and the clinics were able to get reimbursed as well through insurance coverage. So I think that was a big change, and maybe a lot of parents and patients don't realize the limitations and difficulties doctors had providing telehealth prior to um, the onset. So I think that was one of the main challenges. And now that we're past COVID, or getting further past it, and we can go back to the clinic, I think it's really shown a stronghold in certain areas. As I mentioned, behavioral health. I know adults are seeking a lot of psychology and psychiatric care through the internet, and also management of some aspects of autism is appropriate, and certainly epilepsy, because a lot of it is listening to what's happening and making decisions about medications and so on based on the story, the history from the family and the patient, and also the data that we can review remotely, MRIs and EEGs, and genetic testing results. And I think that the opportunities for this is, reaching a lot of underserved communities, folks who
Absolutely.
can't see specialists, in multiple, uh, can't get, across state or across the country, and maybe they can get access to the internet through programs like the Child Neurology Foundation provides internet access and ways to access telehealth if you qualify. So I think those are some of the, opportunities and challenges. What do you think would be, or how would you think telehealth could be different or could work better for yourself and your family?
Yeah, so before the pandemic, I also didn't really know that this was an option. Since having that accessibility to do multiple appointments in the week, not have to travel, I'm reallocating a lot of money and time back into my family, and also that reach to other doctors in different states. I'm worried that now that m- more people that have always been able to access um, doctors and appointments, maybe because they have the money or they're in the area. But as a disabled mom with children that have a lot of needs and a lot of appointments, I'm worried that it's going to become less accessible for us. Like recently, I had an appointment for myself. It was a physiatry follow up. Um, Unfortunately, after Thanksgiving, the whole family fell fell sick. We were all sick, and my daughter, my youngest, who has epilepsy, you have to watch her when she spikes a fever because we often have breakthrough seizures. So I didn't want to leave her. I'm the primary comfort parent when she's not feeling well, so she doesn't detach from me very well. And I had called to see if I could do a telehealth. Um, Problem is, insurances are now pulling back and not covering, now that the COVID-19 threat has kind of lessened. And that's really unfortunate, because I actually had to reschedule, which means I had to bump my children's appointments as well later this month. And, it was just a follow up that could have easily been over the phone or like we're talking on the computer. But the problem is that insurance is not giving a straight answer, a transparent answer of whether they're going to cover it or not.
This was a out-of-state appointment,
Actually, it was in state
in-state,
in my
and there's
yes.
still. Hmm.
Yeah,
So
news
I
to
haven't
me.
run into that issue yet,
Mhm.
but it is true that those with commercial insurance, Blue Cross, etc., would have you know more access to telehealth before COVID-19 because they might have had coverage in different states and so on. It would be not be dependent on the state, but those with Medicaid would be um, only able to get telehealth within their own state. And so what I've had to do with my clinic based in Illinois is get uh, credentialed with all of the Medicaids in the states which I practice, so I can accept that. And I can see that a lot of hospitals would not probably be able to do that for all their providers, or it would be a major hardship. I have a solo practice, so it's just something I've chosen to do, so I can see everybody in those states. But um, yep, it's definitely challenging, or that could be a personal decision by the I don't know. You said it was the insurance, not the clinic. The clinic was willing to do so, I guess.
Yeah.
But the reimbursement may be lower than an in-person visit, so they may be reluctant to give up that slot if they're going to, have less reimbursement for that time. So there's a lot of things, at work for these changes that are slowly happening.
Is there anything that you think, as a patient and caregiver, I could do to maybe help with making changes to make this accessible permanently? What can we do?
Well, I think that talk to your doctor and say how much you value it. And, you just explained perfect reasoning for, why it's useful for your own visits and your children's visits and your particular situation. So they should, you know, do what they can to make accommodations to and I hope that the law will require them to make accommodations so that those who can't physically be there or should physically be there because of medical reasons um, uh, will have access to the care that they need. So I would start with your provider, and we can all, when it comes up for, all the laws come from our lawmakers, and we don't have to all go lobby, but we can think about that when we're voting and talk to our local lawmakers if we're so inclined. I've never done it myself, but I think organizations like the Epilepsy Foundation and the Child Neurology Foundation have people working with uh, the lawmakers to help kids or help families help their kids. So um, I think supporting the Child Neurology Foundation is another great and easy way to do it. They'll do the hard work. We just have to support them and give them great information about why we need it.
Yeah, definitely something I can do supporting CNF. Is there any other resources or anything that you'd like to share with other patients or caregivers?
I think some of the things that when I talk about telehealth is maybe some very basic things. Maybe you do these things. You've done a lot of telehealth visits. Sounds like so. Um, when you're going to have a visit, make sure your computer's working, turning on, maybe reboot it beforehand so that the RAM or whatever it's called is all cleared out and it's working as well as it can. Check your internet connection, and then pick a good, quiet place. You and I both picked quiet places in our homes where we're not going to be, hopefully, interrupted by animals or pets or other things which might, disturb the conversation with your provider. And if you have a small child, sort of tell them what you're going to do. Maybe practice before the first time on a Zoom or something, maybe with family. Sort of, uh, you remember what examinations they do in the office, so some of those things, just so they know kind of what to expect. And maybe even prompt them, so they know they can respond to the doctor on the video themselves, or if they're nonverbal, some hand signals, thumbs up or something like that, or how are you feeling, if they're able to communicate that way. So I think uh, those are some of the nuts and bolts of telehealth. Make it best for your doctor and yourself. I think from the doctor's perspective, I think one of the best things about telehealth is staying on time. For some reason, we always sort of sticks to the schedule online, and when we're in clinic, we always get behind. I think because there's so many variables, families have to go through. They drive. Well, my practice was in a downtown Chicago, so you have to fight the traffic, make it into a 10-story parking garage, the elevator in the parking garage, the elevator, the front entrance to the hospital line, there's just a lot that can happen, and then the waiting room and checking in and getting to the room and getting vitals, and all these things can make the timing off. And so families with children in wheelchairs, I can't imagine, you know, it must be like a whole day just for, a 30 to 60-minute visit. So I guess we do what we have to do, but if some of it can be done electronically, I think that's a really great
Cute.
great advance in delivery of healthcare.
Oh yeah. I know that with my kiddo, um, to go to her neurologist, if we have to be in person, it's like 3 hours one way, if not hitting traffic, because we live in a really rural area. Um, so if she is just going there for like a follow up, most likely she's not going to be in the best of moods when she gets there and goes through that whole process of the parking garage and everything. It is nice to have some of these appointments virtually, because I feel like she is showing more of like her baseline, how she her temperament would be if she wasn't in the car for like 6 hours. So it's definitely huge, and I'm so thankful for being able to access any telehealth.
Yes, absolutely. If I can see my patient who may have um, challenging behaviors, if I can see what they're like, at their own kitchen table or living room carpet, playing quietly with toys, or if that's not the case, if they're wiggling all over the place and upset and in pain, even in that environment, that will give me some great insight into, side effects from medications, or
Mhm.
how uh, how the treatment may need to be changed, or so on. If I see them that way in the office, I might chalk it all up to, the strange environment. So it's really helpful information. Um, so I think we covered a lot of
I think I have one
the
more
main
question
aspects.
for you.
Oh, great.
I think the last question that I have is if you could wave a magic wand, what would you change about the regulations and laws around telehealth?
Well, if I had a magic wand, I would, um, you know, or I would like every patient who is appropriate to receive telehealth have access to it, and that would mean um, those with all types of insurance be accepted, but then those who have challenges with time or money or understanding how it works would be provided support, whether that's internet access or a advocate, visiting nurse to help them uh, conduct the visit from their home. These are all things that I think could be supplied by the law and insurance, and may in the end even be more cost effective than a visit to the hospital in some cases. But I will reiterate that the telehealth is not appropriate for all conditions and um, all types of symptoms and situations. It is particularly helpful for epilepsy, I think, for follow-ups as well, because we can gather a lot from just talking, and the EEG and MRI and genetic testing are our main data points for making decisions. But sometimes children need to come to the hospital. If they're sick with a fever, if they have another condition where they need to be examined closely. We can't look in the back of a child's eye to see whether there's pressure on the brain. We can't check tone, the way that the muscles passively move with um, bending at the elbow and the knee, for example, and check reflexes. We can't really see those things. So sometimes kids need to come to the hospital, but a lot of follow-up visits and even second opinion consultations can really be done over the internet, and I would hope that um, uh, a magic wand is probably not needed. I think just some common sense from regulators and insurance. But if families are aware of it and ask for it, um, ultimately um, consumers win and get the hospitals and insurance companies and lawmakers provide what people want eventually. So we just need to
Yeah.
ask.
And we're continuing the conversation about it now. So hopefully people are still talking about it and asking for it. Um, and I just wanted to say thank you to the Child Neurology Foundation because they helped our family through COVID when, money was really tight. They were able to help me access internet and the Chromebook that I'm currently using right now to be able to access telehealth. And it was just life changing. So thank you to all of you and all the providers that are able to do this for us, families and patients.
Well, that's great to hear, and I really enjoyed having this conversation and getting the word out to those who may not know as much. So thank you.
Thank you.